Hey there, it's Mary Maywald. Hey, I have some information for you that's going to be important for you to hear about. There are some rule changes on Medicare Advantage versus Medicare Supplement Insurance in Washington State coming up. And so I'm going to be doing a presentation. It's going to last probably about 20 minutes or so, explaining the difference between Medicare Advantage and Medicare Supplement Plans. All of you that are getting this are on Medicare Advantage right now. And you've been told by me repeatedly through the years, depending on how long that I've been working with you, I've been telling you that you're always guaranteed into a supplement during certain times of the year, which would be in the fall, right now, October 15th through December 7th, and then also again in the springtime from January 1st through March 31st. That is about to change possibly, and so this information is regarding that. I think to best understand this information that I'm going to give you guys, I think you need to look at my chart and understand the type of insurance you have versus the other type of insurance that you could have. So up at the top of this chart, you can see Original Medicare, Part A, Part B. This is what you guys are paying for every month. It's coming out of your Social Security check. Next year, it's going up to $174 and change. And so this is Original Medicare. Your Part A you've already paid for. Your Part B you pay for every month. Part A of Original Medicare is your hospital stay, and Part B is your medical. So Part A, you're staying overnight in a hospital, skilled nursing, or a hospital. In Part B, this is all the stuff you have done medically that's approved by Original Medicare, and you come home at the end of the day. So doctor visits, labs, day surgery, that sort of thing. So that's Original Medicare, A and B, up there in the top box under Original Medicare. Okay, if you're getting this video or I've told you to watch it, it's because you have a Medicare Advantage plan, option 2. This insurance that you guys have had is private health insurance that manages your Original Medicare. So right now, when you go see a doctor or you go to a hospital, you pay a copay. You have dental and vision and your gym membership, maybe some over-the-counter included in there. These have networks. You can only see certain doctors that are in the network. This is Medicare Advantage. Most of you pay $0 to have this plan going, and you pay co-pays at the door. So that's what we're going to be talking about and comparing to this option 1. And the reason I'm making this video is because some rules possibly are changing in Washington State, and you need to hear about this before the end of this election period, which ends on December 7th. Most of my clients that have Medicare Advantage plans will hear me say each year, if your health changes or if anything changes and you want to try out Medicare Supplemental Insurance, which is option 1, you've always had the opportunity in Washington State to be able to switch over to a Medicare supplement regardless of the status of your health. You can do that through a certain carrier during the annual election period, which is October 15th through December 7th. You can also do this during the open enrollment period, which is January 1st through March 31st. However, recently we were given an email from this carrier telling us that underwriting is going to change and that it's going to change January 1st. We don't know exactly what those changes are going to be at this point, but many of us have a hunch that this guaranteed issue opportunity that exists with this carrier and only during these 2 times a year for people that are on Medicare Advantage, that would be you, this opportunity could be going away. And so next I'm going to discuss how this would affect you and what you need to do. To best understand what this new change is all about, you have to understand what Medicare Supplement Insurance is. So that's what this next part of this presentation is going to be. Right now, you guys have option 2, Medicare Advantage, private health insurance, all under one umbrella, all of your medical, dental, drug plan, all of that under one carrier. The bill goes to you by a copay, and it goes to your private health insurance company, your Medicare Advantage plan. Over here, under option 1, in the blue, what we're talking about is Original Medicare becomes your primary insurance. They get the bill first. and then whatever's left over drops down to your secondary insurance under that option 1 category, your private health insurance lettered plans A through N. That's the way this works. Medicare is your first payer. Your Medicare Supplement Plan would be your second payer, and you'd have a standalone drug plan because supplements do not cover drug plans. That is option 1. This type of insurance costs more money, but it's more comprehensive insurance. In the big picture of bad health, it will probably serve your needs far better than a Medicare Advantage plan. I'm going to explain why that is in the next video. We're going to take a look at the cost involved in one of these Medicare supplement plans. So if you look up and you see the original Medicare, Part A, Part B, let's go back to that. Under Part A next year, if you went in the hospital, you would have a per mittance deductible of $1,632. That's per admittance. Over under Part B, you would have a $240 deductible due one time a year. And then this turns into an 80-20 plan, meaning you owe 20% of Medicare approved amounts. And so this deductible over under Part B, this is, again, Part B is your day in, day out stuff. You're coming home at the end of the day. The first $240 is on you. And then after that, you would be responsible for 20% of Medicare approved amounts. And again, over in the Part A, the deductible is $1,632 per hospital admittance. Now, there's a lot more involved here under the Part A for original Medicare. I'm not going into that kind of detail right here. You can find that in your Medicare and You book. Seldom do I go into that detail with my clients. This is more of just an overview of how these supplements work. So these supplement plans are lettered plans, A through N, and today I'm only going to be talking about Plan G, which is the most comprehensive plan available today for supplemental insurance, and it's the easiest one to understand. So when you have Supplemental Plan G, this is going to fall under this option 1. This is the change that I'm talking about that's coming. If you decide you want Plan G, what that would mean is you'd have 100% coverage when you go in the hospital. So back up there on that original Medicare chart, as you recall, a hospital stay per admittance is going to cost you $1,632. Your Plan G is going to pay that for you. So you will have no overnight stay hospital visit costs with Plan G. With your original Medicare Part B, you have this one time a year deductible of $240 next year. Your Plan G does not pay that. So you will be paying that $240 deductible one time a year. And then at that point, you will have 100% medical coverage under Plan G for 2024. Now, this is only things that are approved by original Medicare medically. So that's how this Plan G works. You have 100% coverage if you stay in the hospital. Under Part B, the day in, day out medical, you have to pay that $240 deductible, and then you'll have that coverage, you'll have medical coverage at 100% for the remainder of the year. These supplements do not cover prescription drugs, so you would be taking a prescription drug plan as a standalone plan. So when you go with option 1, you have your supplemental insurance that pays secondary to your original Medicare, and then you have a standalone drug plan. You will be making copays when you pick up your prescriptions. They could be $0 or they could be far more. And most of these drug plans do have the deductible in them. Some of them are less than others. So that's just another insurance we'd have to figure out. So again, under option 1, you'd have original Medicare as your main payer, your primary insurance. Your supplement would be your secondary insurance, and then you'd have a standalone drug plan. If you wanted dental or vision, those are separate insurance plans that we would be talking about. Okay, so now that you've seen how these Medicare supplement plans work, you've seen the most comprehensive plan, Plan G, you know it's going to cost you the $29.88 out of pocket for a year. That's going to give you 100% coverage. That's the good news. You have to get a drug plan. There's no dental, vision, gym, over the counter. It is expensive, all in all. But you have cut your medical costs at $2,988 for the year. So it's that versus Medicare Advantage, your plan that doesn't cost you any monthly premium or very low monthly premium. It's got predictable co-pays. It includes all that good stuff, dental, vision, over the counter, drug plans in there. That's all good stuff. The bad news is your Medicare Advantage plan can nickel dime you right up to the maximum amount of out of pocket in a year. So for most of you, that's at least $6,500 and up to $6,900. So that is the difference between these two plans. And so now you just have to decide what it's going to be for yourself. Okay, so I'm going to go back to how this video kind of started and fill in what I didn't say in the beginning, I'm going to say right now. So back when I talk to you guys every year, whether I just met you or whether I've been talking to you for years, you've heard me say if your health ever changes or if you ever want to get over to a Medicare supplement insurance plan, you should call me. There's a backdoor way in. We do it this time of year, October 15th through December 7th, or I can usually do it in the start of the year, January 1st through March 31st. Well, that opportunity, I think, is going away. Now, it hasn't been confirmed or denied, but us agents have gotten an email from this carrier telling us that there's going to be changes in the underwriting. And so this is why I felt it was important to get this information out to you, because if you ever did want to go into this type of insurance, now's the time to do it. So you could possibly get into a supplement down the road, but you would have to come through that carrier's individual medical underwriting. And so what that means is they have a list of questions they ask you, and if you can't answer those questions favorably health-wise, then they can deny you, and then you're just stuck in your Medicare Advantage plan, which isn't all bad. And so the Medicare Advantage plans are pretty great. They've been working out this whole time for you. It's just that you need to know that this opportunity could be going away. So that's the point of this video. I hope you found this helpful. You can call me at 206-972-1269 anytime. Leave me a message. I'll get back to you as soon as I possibly can. And that's it. I hope you all doing good, and I hope this clears that up.